I'm Colin Henderson. I'm the Vice President for EMEA for Strategy, Solutions, Partners and Emerging Markets for Orion Health. Orion Health's a software company. We're New Zealand founded, and we see our role as sewing the health system together from an information perspective. One of the big opportunities is for expansion. So there's a number of regions that have made really good progress with building integrated digital care records, which are records that pull together information from acute hospitals, mental health, community health, and bring in local authority data from social care. Creating these integrated digital care record programs and making them successful is quite challenging. It is difficult. But you have a number of organisations and regions that have made great headway, and I think there's an opportunity to grow and expand those sort of vanguard projects out. I think the opportunity is also on understanding the concept of the platform. So the more information that you assemble, the more information you can aggregate, the more you can reason against information, and that gives us opportunities to do things like population health management. I think a big risk is IT not being at the forefront, or not being one of the first steps that people choose to do when they're looking at transforming their health system. It's often been an afterthought. I would strongly advocate that putting the integrated digital care record in as a starting point is the key, because that enables the transformation that can then happen to allow services to be reconfigured. Wherever someone turns up for an episode of care, the information's there to make the most informed decision. If I look at the programmes that have been successful versus those that have maybe been less successful or have struggled, a lot of it's down to leadership and focus and shared vision. And that's both in terms of the individuals who are leading the programmes, but also the stakeholders, the clinicians, the people from local authorities. They're actually the group that are going to bring their community along with them. And often that's what makes the difference between a successful programme and one that struggles, is the ability for that community to have a shared vision, stick with it, consistently deliver that shared vision around. And it's fine for us to go out and talk about integrated care as a supplier, but we'll always be judged as a supplier. When you have, there's no magic bullet for this. It's about a group of individuals getting together and saying this is the right thing to do. I mean, people should be confident and should have the confidence to move forward, because there's been an awful lot of the programmes that have been very successful, and benefits have been published, and they can speak to their peers and clinicians and can hear about those benefits. And I think when you go and speak to the NHS and speak to the regions, there's a real energy and a real enthusiasm, almost a frustration that it's a little bit like seeing the mirage in the desert sometimes, where they can see it, but they're almost struggling to get there. And that's when I think just a little bit of guidance of a roadmap from someone that's been there before can be so useful.